Hello and welcome to Paper of the Week. And today we have got a British Medical Journal Sports Therapy edition of Paper of the Week. This is published this year, 2019. And basically, there's a condition that a lot of athletes get, and I'm one of them, and I have this condition, and it's called tendinopathy. And what it basically means is inflammation and degradation of the tendon. I have tendinopathy in my heel. Okay, which is great, It's just terrible because, of course, you can't get up and do your runs. You can't move, you can't walk too far, and it restricts your ability to dance, for example, and you don't want that. So this paper talks about, well, what's the best way to treat tendinopathy, of course, and, tendinopathy is when you... it is a pain. It is a real pain. I know, I speak from experience. Now, let's say you do the conservative treatments. The physio will tell you to do certain concentric exercises, which is, extending your toe up like that and then releasing the pressure like that. There's rehab exercises you can do to help the tendinopathy. In my case, it's the Achilles tendon. There's shockwave therapy. And I'm not talking shock and awe like the president of the United States, the great orange man, will tell you. This is not that sort of shock and awe. This is shock and awe from the tendinopathy. This is where you put an electric pulse onto the tendon and it breaks up the calcification on there. So that's the problem that you have. So that's another treatment you can get. But of course, if all this doesn't work, there's one, and that is surgery. And this trial is titled, How Does Surgery Compare to Sham Surgery or Physiotherapy as a Treatment for Tendinopathy? And it's a systemic review of randomized trials, so lots of trials. Now, what is a sham surgery? Sounds like a dodgy surgery. What it is, it's a placebo surgery. So, for example, a sham surgery would involve getting the particular joint, in this case my heel, and cutting it open and then sewing you back up. So it looks like, from all intensive purposes, you've had surgery, but it's called a sham surgery. And so we have to do these trials to investigate whether it's the surgery that helps or not. And so, let's say you've got this tendinopathy and you've been told not to run, you're resting it, doesn't help. Go to the physio, get the exercises, the shockwave therapy or whatever it is, and it doesn't help. And so you've got this conundrum where, you go, well, what do I do now? And the thing you've got to do now is you've got to be able to treat it correctly. So you go to the surgeon, and you say, look, I need surgery on my joint to fix this up. This trial said, okay, does surgery help or does sham surgery? Now, I'm going to skip straight to the end here because I'm going to read the ends, and you won't even believe this. This is the conclusion of the trial. In the systemic review of 12 eligible randomized controlled trials in patients with various tendinopathies, surgery was not superior to sham surgery in patients with tendinopathy, blah, 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 in the midterm and long term. So basically what they found was surgery did nothing compared to sham surgery. So I'll repeat that. Sham surgery is when you cut open an area and do nothing to the tendon and just sew them back up. Tendon surgery is when you cut open the tendon, pull the tendon out, reinsert it, reattach it, shave the bone, and put it back in. That's the real surgery. And what they found was the sham surgery was no better than the sham surgery. So the surgery, no better than sham surgery. Now, why is that so? So let's say I cut your heel open, in my case heel, and I certainly, do some sort of surgery on you, and it doesn't help. So what is making the person better? Well, what is actually making the person better is after you have surgery, you have to go through a series of rehab exercises. And these rehab exercises have benefit on the tendon. And what they found was that it wasn't the surgery that had the benefit. It was actually the rehab exercises post-surgery that had the benefit. Now, we know that because they compared it to sham surgeries where they just cut the skin open and then sewed you back up. And both of those things were equivalently as effective as helping the particular tendinopathy. So isn't that fascinating? You really, really would think that surgery would be better than sham surgery, but no. This systemic review of 12 randomized controlled trials showed that sham surgery was about the same effectiveness as having real surgery. So advice for you is firstly, take some stuff to help with your tendons, like, of course, collagen-based supplements like we've got here. Second thing is, if you've got a tendinopathy, get it treated by a physio, take anti-inflammatory herbs and those sorts of things. And thirdly, if you have to have a surgery, think very, very carefully about the surgery. If you rupture your tendon, you need surgery, no question. But for tendinopathy, this trial show that sham surgery was no better. Well, isn't that amazing? And that's an amazing paper to end on. So thank you very much, and I hope you enjoyed Paper of the Week. We'll see you next week.